Medication can sometimes be a very effective method of treating an anxiety disorder. Drug therapy can either be a short-term or a long-term treatment option, depending on your individual needs. There are three classes of drugs that are commonly used to treat anxiety disorders: antidepressants, benzodiazepines, and beta blockers. There are more than 24 different kinds of antidepressants available on the market today, but there are four main types: tricyclics, monoamine oxidase inhibitors, or MAOIs, selective serotonin reuptake inhibitors, or SSRIs, and serotonin and noradrenaline reuptake inhibitors, commonly referred to as SNRIs. Antidepressants work by restoring the normal balance of hormones and neurotransmitters in the brain. These drugs stimulate chemical changes that increase the levels of some or all of the three main neurotransmitters associated with mood: serotonin, norepinephrine, and dopamine. Antidepressants are typically effective after being taken for at least a few weeks. Benzodiazepines are another common class of drug used to treat anxiety disorders. These drugs work by affecting those areas of the brain that control emotional reactions, memory, thinking, consciousness, and coordination. Because benzodiazepines have a high risk of dependency, they are generally prescribed for shorter periods of time or in conjunction with an antidepressant. Beta blockers, which are usually used to treat heart conditions, are also sometimes prescribed to treat an anxiety disorder. Beta blockers can be used to keep the physical symptoms of an anxiety disorder under control by interfering with the action of adrenaline and its related chemicals. Beta blockers are most often prescribed for social phobias. For instance, if a feared situation can be predicted in advance, your doctor may prescribe a beta blocker to help calm the symptoms of anxiety that arise in that situation. With so many drugs to choose from, which one is right for you? That will depend on several factors and is often a trade-off between the likelihood of it working and the chances it will cause side effects. When you are first prescribed a new drug, be sure to ask about the most common side effects and what to do if they occur. Your doctor may be able to adjust the dosage or frequency of your medication to help eliminate them. Also, make sure to ask your doctor why a particular drug has been selected for you over the other drugs available. Whatever medication you decide to use, it's very important to follow your doctor's instructions exactly. Even if you begin to feel better, you should continue to take your medication as prescribed. If you decide to discontinue your medication, this should first be discussed with your doctor. In some cases, stopping medications abruptly can lead to adverse effects. Although not studied scientifically, many people believe that other simple changes in your lifestyle may also help alleviate the symptoms of your anxiety disorder. These include a good diet, regular exercise, and incorporating alternative therapies such as relaxation techniques. However, if you are considering using any alternative therapies, it's important to discuss them with your doctor first. For The Answered Patient, I'm Dr. Gerald Chodak.